Whether you're born in Africa or not, you probably heard of the healthcare crisis facing the continent. It's still very expensive for the poor, and accessibility to medical services has always been a thorny issue. Well, thanks to technology and the mind of enterprising people like Dr. Michael Mall, millions of South Africans can now have access to expert health advice from qualified medical doctors via their mobile phone. The Hello Doctor app has already captivated around 600,000 subscribers in South Africa who appreciate what it means to have a doctor to talk to 24 hours a day, 7 days a week. Well, we chatted to Dr. Michael Mall to find out more about how the simple app is changing lives.
Hello, Doctor.
Hello, Dr. Michael Mall.
Machina.
What a big pleasure to have you with us on Joburg today to talk about this very new, exciting venture. Not new, but it's the app that's new and it's the service that you focused on.
Well, it feels new. We've been going around for about 5 years trying to get this come to life and make it real and get people to buy into the concept. So, yeah, it's been around for a while.
Okay, we're always interested in the backstory because it's inspiring to know when you first conceived this whole concept. I'm talking about the serious service that you're offering via this app, which, I mean, on the face of it, which is why the story caught our interest, it looks like it has the potential of reshaping the medical industry to some degree.
It does. We think global domination.
Good,
Machina.
way to go.
I tell you why and where it started. We, as part of the African continent, we were born into a healthcare crisis.
Yeah.
So 25% of the global burden of disease is in Africa. We have 3% of healthcare workers, 1% of healthcare expenditure. So there's a crisis. We're never going to create more doctors, more hospitals, or rather enough doctors, enough hospitals, clinics, etc. So we're on a hiding to nothing. There must be another way to deal with the healthcare crisis. And we looked at that, and as a medical doctor myself, realized there are more phones in Africa and in South Africa than there are people.
Yes.
So why don't we use the phone to bring healthcare? I mean, it's the way the world is moving. There are two things every African has: tuberculosis and a mobile phone.
Absolutely.
So let's use one to treat the other. And that's really where it started.
Sure, it's a sad reality we face in Africa, as you just pointed out. But you're confident that you have started to fill this massive gap already. Tell us about the service. How is it more accessible? How are you really reaching out to the millions?
Well, it's based on the premise, and this is a global premise, irrespective of where we are, whether it's South Africa, Indonesia, Kenya, the United States. Around 60 to 70% of all visits to a primary care facility, a GP, a clinic, a hospital, are non-essential. In other words, you could have actually dealt with it remotely or over the phone. Now, you can imagine if you take away that 70% out of the public healthcare system, suddenly the patients that really need treatment are actually being treated. The patients that need to be there are being seen, and those that don't need to be there are being dealt with very quickly, very efficiently over the phone. They don't have to wait in a queue. They don't have to pay transport to get to the clinic. They don't have to wait there all day. That's why they're called day clinics. Yes. They get serviced immediately. And that's really the kind of magic of the service. So we will never replace that face-to-face interaction with a doctor. We don't claim to, we don't want to. Yeah. But we do want to deal with the unnecessary visits. And you're not medical, Machina, so how would you know when you need to see a doctor? When is it serious, when is it not? I've got a 3-year-old child with a fever. Do I take the child to a hospital or a doctor, or do I just wait and see? I don't know. Google tells me the child is dying of some horrendous brain tumor. Dr. Google knows a lot, but it doesn't know you, it doesn't know your circumstances. And so what we're really trying to do is fill that gap and say, talk to a doctor from your own country, in your own language, on a medium that you can afford, and that you can understand. So the big dream was, it doesn't matter what phone you have, you can have an old Nokia 6210 or an iPhone 10, it doesn't matter. You can still access Hello Doctor services either on the app or a Mobi site or USSD. So whatever your preference, you have access to our services.
That makes total sense. You answered my next question,
I'll shorten the answers.
Us still being faithful to our family GPs, our family doctors. So but they're not always accessible.
They're not. No,
they're not. For free advice as well.
Yeah. Well, that's true too. For GPs, tired of being WhatsApped and asking for advice when they kind of realize, guys, don't WhatsApp me. This is the service I offer to you. But you're one of the fortunate few that has a GP or a family GP.
Yeah.
Keep that in mind. There are 14% of South Africans that have access to their own GP. The remaining 86% simply don't.
That's the
and they're
sad
dependent
reality.
on the public healthcare system. And there are great doctors.
So, but
in
this
the
is for
public healthcare
everyone. I
system.
mean, I could make use of it as well.
Absolutely. So for you, it
The
might
free
be more
advice.
convenient. For someone
We all
that-
need it. I mean, we all need advice in the moment. Something happens, something comes up in your body, like, oh, okay, how serious is that?
Well,
Is
exactly.
it cancer?
Well,
No,
think about it.
seriously, these questions come up.
Sure. And when people do Google it, you can imagine the differential diagnosis. So you get met with, the tumor, the cancer, all the worst conditions.
You have 1,000 more questions rotating in your head.
And
Yeah.
you got something called cyberchondria, which is that's what Google creates. And you
Sure.
don't want that to happen. Then there's anxiety, and
Yeah.
then you want to get hold of a doctor. Whereas and in fact, you don't need to pick up the phone. It's a callback request. So you don't even need to pay for the call. We cover the cost of the call. Our doctors phone you. And
Wow.
it's with the promises within an hour, we'll phone you back. On average, we're around 10 minutes.
Uh-huh.
So 24/7, any time of the day, anywhere you say, I need to speak to a doctor, and our doctors are going to call you back to answer any question. I'm about to go to a dinner party, they're serving sushi, I know I'm pregnant, I can't tell anyone else I'm pregnant, can I eat the sushi or not, doc? Those kinds of questions. So, or it's 3 a.m. and your little child, your 2-year-old daughter's got a fever.
Yeah.
Classic example, what do? Do you rush off to the emergency room and fork out your 800 Rand, or
Yes.
you subscribe to a service that allows you to get hold of a doctor anytime and just say, listen, this is my daughter, this is the fever, no rashes, no neck stiffness, she's not nauseous, can I wait? Sure, no problem. Call us again in an hour if you're concerned. So
Sure.
it puts a doctor in your pocket.
Are there any limitations?
Sure. So we in this country will never diagnose and will never prescribe medication to you. That's the regulations in South Africa, and we've stuck by that. So we don't operate above the law. In other countries that we operate in, Kenya is a great example. The Ministry of Health saw this and went, this will really make a difference to our people. And we helped them come up with 30 conditions that we can safely treat remotely without endangering a patient.
Yeah.
And through a long sort of list of exclusionary questions that will allow us to actually diagnose those 30 conditions. And we're talking about acne and asthma and gout and things that you don't actually need to see. Cystitis, contraception we can talk about over the phone. And we can prescribe that medication directly via the phone. So in Kenya, we're sending scripts via SMS. Goes to the pharmacist, the pharmacist looks at that, validates that the script hasn't been used more than once, and medication is received.
So,
wonderful system.
So your network is huge. Sorry, you have a huge network of doctors available that's part of this. How did you get them on board?
Well, so the big promise to our users was a doctor in your own country. So we don't service Kenyans with South African doctors. There are Kenyans servicing, the Kenyan people. Speak French, speak Swahili, understand that there are certain conditions in Kenya, Nairobi, wherever that are more prevalent than there would be in South Africa that our South African doctors don't understand, for example. So very much local doctors for local people.
Sounds fantastic. And what has the uptake been like in South Africa?
Well, the initial approach was B2B, so we went to companies to say, listen, in South Africa there are 9 million employed uninsured people. In other words, they've got jobs, but they don't have medical health care. So we're saying we could provide a modicum of healthcare for that employed population. You as the business pay for them on a monthly basis, pay a subscription, and we'll cover them. And that's what we've done, and we've got around 600,000 users as far as that's concerned. And then we decided to open it up to everybody, to say if you're willing to put your hand in your pocket and pay for the service for 55 Rand a month, which is 2 cappuccinos, you can have a doctor on call 24/7 for you and your entire family. And the thinking behind that, Shima, is not so much when you need a doctor, call us. Obviously, that's going to happen.
Yep.
But we want to break down the barriers of access to healthcare so that even when you don't need a doctor, or even when you're not sick, you just want to call a doctor and say, listen, my son seemed to react when I give him anything with egg in it, or how dangerous is a nut allergy, or we're thinking of having the flu jab. Is it safe for my family? I've got a 2-year-old. Can she have the flu jab? So you're starting to ask your doctor and engage with your doctors long before you get sick.
Yes.
Which moves us into that realm of prevention, not cure, and that's the sweet spot. That's where we want to get to. Is you never want to get sick, you want to prevent disease.
Okay, so this is the first of its kind for Africa. The first of its kind for Africa.
It wouldn't be the first of its kind. A lot of people have tried, a lot of people have failed. Different models that haven't worked. There was Hello Daktari in Kenya. They had a great system, but the problem there was they required users to phone in to speak to doctors. So they had doctors in call centers and waiting for people to call in. The problem there is people don't have airtime. You know, or they've got 2-3 minutes worth of airtime. They run out of airtime. You drop the call. You can't get the patient back.
Sure.
Not a great service. So we flipped that on its head.
And the cost of running call centers.
Well, exactly. And having doctors, bums and seats is expensive. We've said now we've got doctors that are part-timers, that have got kids, that are she GPs. We're saying don't come into work, don't come into a call center. We'll ping you when someone wants you to give them a call, and we'll make the outgoing calls. In other words, someone without airtime can still access our services, and our doctors don't need to be in a call center. They can be at home, they can be on the beach, they can be anywhere they are and respond to these queries whenever they come up.
Well, some of them, as you said, has failed, but I'm sure that everyone would be rooting for this kind of service to be sustained across the continent, as you highlighted the challenges we face.
Well, there's a significant move from the World Health Organization to deal with health for all via IT or mobile services. They've also recognized the value of a mobile phone and what can be done over this phone. So I think it'll take time too for governments, for policymakers to start, and I don't want to say relaxing regulation, but letting up on regulation to say, hey, let's experiment with this. Let's see how much we can do with this, because there's a far greater chance of doing good than doing bad.